Oh, we did. Thank you for offering that.
Yes.
You know what, Mom, this is just easy. Instead of putting all the concrete in the barrel first and then putting the water, let's just put the water first. And then we'll mix until it's good. And actually it came out good. I was maybe out of order. We kind of wasted half a bag. We had 6 bags. But at the very end, I think, not a bad idea.
Law requires body to announce at this time that a copy of the current Open Meetings Act is available at the back of the room or is accessible to the public. Please. Here. Tiller.
Here. Here.
Gibbons. Here. Harrington.
Here.
Euchre.
Here.
Johnson.
Here.
Smith.
Here.
Please rise for a moment of silence followed by the Pledge of Allegiance. Thank you. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Agenda item number 1, consent agenda. Approve this agenda. Pay the claims as submitted. Approve the treasurer's report. And D, approve the minutes for June 6, 2023 regular council meeting. We had a couple of, I think from your packet.
I missed an abstention for Nick on Veterans Committee, and I missed an abstention for Stacy on Lost Regulation. Those have been
Right.
fixed now.
So, can I move?
I'll make a motion as amended.
Corey? Yeah.
Was it Ben?
Ben was second, yes, I'm sorry.
Miller.
Yes.
Wolf.
Yes.
Gibbons.
Yes.
Harrington.
Yes.
Euchre.
Yes.
Johnson.
Yes.
Smith.
Yes.
Weeks.
Yes.
Public forum, item agenda 2, public forum. Anybody to address a non-agenda item? Please state your name, please.
Gary Bodenheimer.
Gary?
I want to talk about the elevator in the library. My wife has been stuck in it. I was stuck in the basement. I don't know what can be done about that elevator, but it is not safe to ride, either up or down, because you never know when it's going to stop. So, just want to put that thought in your mind. You know, back when they were trying to get a new library, the elevator was a big issue.
Right.
And it still is. Thank you.
Thank you. Anybody else for public forum? I will close public forum at this time. Item agenda 3, approve free day of swimming sponsored by Phelps Memorial Health Center. National Swimming Pool Day, Tuesday, July 11th, 2023.
Hi.
Hello.
How are you guys? My name is Carrie Berry, and I'm representing Phelps Memorial Health Center. Phelps Memorial would like to, again this year, we did last year, but host and sponsor a free swim day at the Holdrege pool. Last year we had several area pools, and we are just using this as a platform to promote swimming safety, offering people a chance to go to the pools free. And what we request back from the pool or the city is just to track numbers, and we pay the non-season pass people. So if it's under $100, we will just make a minimum donation of $100 to the pool. In 2022, we wrote a check for $242 to the pool, and we'd like to do that again this year. Do you have any questions for me? Or?
Same as last year.
Yep, same as last year.
I'll make a motion to approve.
And-
Second.
And Larry?
Smith.
Yes.
Weeks.
Yes.
Tiller.
Yes.
Wolf.
Yes.
Gibbons.
Yes.
Harrington,
Yes.
Euchre,
Yes.
Johnson.
Yes.
Thank
you,
you.
Gary.
Thank you for your time.
Item agenda 4, approve the use of city sidewalks during the Holdrege sidewalk sales, July 13th through the 16th.
I'm Kelsey Williams with the Holdrege Chamber of Commerce. Our annual sidewalk sales will be held July 13th through the 16th. And then retailers just bring out sidewalk sale items, and only probably about 3 did last year, but we just wanted the use of the sidewalks.
Questions, comments?
I'll make the motion to approve.
Ben moves.
I'll second.
Nick?
Smith,
Yes.
Reese,
Yes.
Tiller,
Yes.
Wolf,
Yes.
Givens,
Yes.
Harrington,
Yes.
Euchre,
Yes.
Johnson.
Yes.
Awesome. And thank you for all your stewardship help. We worked with several of you in the room, for sand to the car show to city personnel and freight judges. I'm probably missing a few, but thank you so much.
Thank you.
Thank you. Item agenda 5, receive Two Rivers Public Health Department report.
Good evening.
Good evening.
I am Vaughn Lutz. I am Clinical Services Manager for for Two Rivers Public Health Department.
My name is Jesse Valenti. I'm the Finance Sector Manager for Two Rivers Public Health.
We just wanted to, first of all, we want to thank you for allowing us to come speak to you. We haven't been down here in quite some time, and so we just kind of wanted to give an update on what we are doing and see if anybody has any questions. I believe, did they send you the PowerPoint?
Yep.
Okay, perfect. So this here just kind of tells who we are. We're people, programs, and opportunities. Next slide, please. And this is the area that we cover. We cover 7 counties, and as you all know, Phelps County is our 3rd largest county in our district. We are the 4th largest rural health district, or the 4th largest health district in the state of Nebraska, covering just over 97,000 people per population. Next one, please. And this just gives our mission and our vision of Two Rivers Public Health. Next, please. So I kind of want to talk about our six of our programs. Legal epidemiology is one of the newest areas. We received a grant, and we were asked to participate in a cohort. We are one of 6 state health departments and 1 statewide organization that was asked to join this cohort throughout the United States. So it is kind of an elite group, and it is mentored by Change Lab Solutions and the CDC. Kind of the whole purpose about this is to help guide our legals into epidemiology for local health departments and what information can and should be shared and at what levels with the public. So next one, please. Environmental health is an area that we are super excited about getting into. Recently, we have received a lot of health complaints about bed bugs, mold, and indoor air quality across our entire district, and this can be from businesses, hotels, even into rental homes. So we're applying for grants to allow monies to address environmental health issues for businesses as well as residential. A lot of the things we hear about is lead paint. As you probably all know, high levels of lead in children really affects their learning abilities and whatnot, and therefore that transfers into adulthood and unfortunately can become less productive citizens, shall we say. So we're out there trying to help prevent some of that and get our children to be the best that they can be. So Vector-borne disease surveillance is something with the environmental health that started in May of this year. We are doing tick sampling. I believe we just did our last collection of ticks. We had 3 different locations throughout the district that we collected from and send those in, and they're going to see what kind of ticks they are for our area, because that changes from time to time. As of right now, we don't have any in our area that, I can't remember the name of the tick, that carries yellow spotted fever, but there is in kind of the northeastern part of the state. So it's just kind of keeping an eye on things to make sure that they're not migrating here, and if they are, that we can alert the public and let them know that these are concerns at this time in our district. So
real quick, what is arboviral?
It's vector-borne, like West Nile virus, ticks with Rocky Mountain spotted fever, yellow fever, and things like that.
Thank you.
So we do report on those, and we do follow up and do disease surveillance on all those kinds of things, as well as everybody knows, COVID was a huge thing for disease surveillance for us. Now we don't even really track that anymore. We do it just like we do flu in the fall. But we do have a STI program. So we do all the disease investigations and whatnot with the STIs across the district. Also, what I'm trying to say here. Sorry about that.
I think we covered most of it right there.
Yeah, tuberculosis, hepatitis, and those kinds of things. So we do all that follow up. And as far as like tuberculosis goes, if there's anybody in our district that contracted or has contracted tuberculosis, we work very closely with the state to do daily medications with them and make sure that they're taking their medications and things like that, and quarantining to keep it from spreading. So, next slide, please. Home visitation is the newest area that we have delved into. We were actually asked by the state to head this up. In 2020, there was an assessment done, and you can see in red the counties that were most affected by this. Now, a lot of that is lower income families, and unfortunately, that kind of translates to more child abuse cases and whatnot. Dawson County and Gosper County in our district were 2 of the counties across the state that were named as in need of services. So this is a complete voluntary program. I know a lot of times when people hear about home visitation, they associate that with CPS. This is way before that. This is it's kind of designed to work with younger parents, especially, to help give them some skills and support them. We go from prenatal through 3 years of age. We're going to help with parenting skills. We're going to help with family goal planning, health care for maternal and child health care, child development resources, and referrals to community resources. Now, one of the big things when this all started was, are you going to be stepping on toes like Sixpence and stuff like that? And Sixpence is excited to have us come in to help provide these services, because a lot of these people that need the services are not qualifying under Sixpence, and they don't have the staffing to be able to do that too. So this is something to help along with that. We aren't stepping on any toes or trying to take any business per se away from anybody, but just trying to make our families better throughout our district. So, next slide, please. So the immunization program, I know everybody is fully aware of Two Rivers and giving COVID shots out there, but we do a lot more than that. We offer a full array of childhood vaccines. We have the VFC program, which is vaccines for children. Children are considered in the state of Nebraska 0 to 18 years of age. So if anybody is on Medicaid or uninsured, they can receive free immunizations through the health department or through the VFC program. Some clinics and hospitals do also have the VFC program too, but it's fewer and far between. Our whole idea is we want to fill the gaps where other people are not able to get to. So we offer traveling clinics. As you all know, we come to Holdrege once a month. In fact, we'll hopefully be in town tomorrow. We have it scheduled. We have moved to by appointment only. So we were going to some clinics and we maybe would have one person show up in a 2, 3, 4 hour period. And that's really a waste of resources for us. So we went to appointment only, and like for tomorrow, if we don't have any appointments by noon tomorrow, then we will cancel the clinic. So if you know that we're coming to town and you're like, well, they didn't bother to show up, well, that's the reason why, is because we didn't have any appointments. So we have kind of moved to that to all of our traveling clinics. So we do offer monthly clinics. We actually offer weekly clinics at our office. They're in Grand Island, Kearney. I can't even talk. I used to live in Grand Island, so I apologize for that. We have a weekly clinic at our office in Kearney, and then we offer monthly ones here in Holdrege, Cozad, and Lexington. We have worked with different people throughout our whole district with the immunization program, and if there is a need someplace, in fact, we just went down to Alma and held a clinic down there, but it's not a regularly scheduled one. So adult vaccines, unfortunately, that's a little tougher to deal with. We offer COVID, influenza, and shingles for adults. The shingle shots are extremely expensive, and it is a 2-shot series. If you are uninsured, we ask for a $175 donation. And I know that's a lot of money, but our cost on it is over $200 per dose. So we aren't even meeting costs with that. So we're trying to help out as much as we can in some of those areas. If you have insurance, most insurances will cover the shingle shot unless you have Medicare. Unfortunately, Medicare right now does not cover shingle shots. So otherwise, if you have other private insurance, then we don't charge that. We will bill insurance for it. So we do, like I said, the full array of required and recommended vaccines for children. And babies need shots at 2, 4, 6, 12 months, and then 15 to 18. And then children 4 to 6 for kindergarten shots, and then 11 to 13 for the 7th grade shots. Next slide, please. So our dental program, one thing I'm really proud of with our dental program, we actually wrote an abstract and sent it to the NACHO conference coming up in Denver. Our abstract was chosen, so we will actually be able to present on our dental program at a national conference in Denver next month. So some of the quick numbers here of that. And it's been in existence since 2012. We do basic screenings, we do dental education, we do fluoride treatments and teeth sealants. In 2022, we screened 2,669 children. Now, the cost per child is about $12, is what it costs to do services for those. And we do not charge anything to the kiddos or the families for the dental program. It is all funded by grants and donations that we receive. The other thing that we're very proud of is we just did, every year we do a drive at the office for employees giving to their dental program. We had 100% participation from our entire staff that is donating every paycheck to the dental program. So that's how important that is to a lot of those. Here in Holdrege, we were able this last year to do the Head Start, and we did All Saints School here in Holdrege. So we did, like I said, we did 2,669 screenings in 27 schools across 6 counties. We applied 1,393 fluoride treatments and sealed 2,600 teeth. We referred 514 children for further treatment and follow-up, and 100 of those had urgent needs, meaning they were in pain. They had abscesses, completely bombed out teeth and whatnot. Of those 100 children that were referred for urgent needs, we actually probably got services for, I think it was 32 of them that were uninsured, and we found placement for them for their treatment. So those are just some of the things that we've been doing at Two Rivers and that we're going to keep on doing for your community and the whole community throughout the district. So we appreciate your time. And did anybody have any questions about anything?
Just real quick, the number you gave, how many, is that broken down to Phelps County, that number of?
No, it is not. That is throughout our whole district. Like I said, Phelps County, we just did the Head Start and All Saints is all that we did here. Well, no, in Phelps County, we also did Bertrand and we did Loomis. I believe, if my memory serves me correctly, I believe that we did right at 200 screenings for Phelps County. So in Holdrege, we did about 70 here in Holdrege. All right. Well, again, we thank you for your time, and you all have a wonderful day. And if you ever have any questions, feel free to give us a call.
All right.
Thank you.
Item agenda 6, reschedule the first meeting of July to July 5th, 2023 at 6 p.m. I think this was decided last week. We meet in
Have to, you just make it a plan.
Make a motion.
Nick and Stacy.
Weeks,
Yes.
Tiller,
Yes.
Wolf,
Yes.
Kevin,
Yes.
Franklin,
Yes.
Hubert,
Yes.
Johnson.
Yes.
Yes. You want to put that on your calendar. All right, open discussion. Let's start with Chief.
I don't have much. The truck should be done soon, so excited to get that out. No, that's all I've got.
Congratulations on your bust earlier in the week or last week.
Thank you.
Good work. Good work.
Did so hard myself, I guess, yeah. Officer Rodewald and Palmer did a great job with that, so.
Great. Thank you. Dane?
Thanks, that's it.
Chris?
Had some interest in 906 Garfield on that lot. We need to decide how we want to sell that. I know one time we talked about. Is that your address?
No, it was my next door.
Oh, sorry. I thought I had the right address.
He was talking about buying it.
Oh, okay. One time we talked about giving it to the CRA and let them selling it, or the city's doing it through the process of taking the bids on it. So it's, you guys can think about that. And, kind of let me know what you think on that.
Was the CRA interested?
The CRA would take it, and then they could. It's easier for them to sell than it is for the city. So if you want to go that route, I'm sure they would take it and go that route. That gives them a little money to put in their coffers to do projects with. So we had our meeting with Benjamin's on do some value engineering on the ball field project. Looks like that's going to come in and save us about $125,000. So we'll be bringing some change orders before the council probably next month, probably the second meeting next month. So that's all I got.
Good. Thank you. Nick?
Nothing.
Ben?
I just want to say nice job to the chamber for Swedish Days. We were down there, enjoyed most of it, and I thought everything went pretty good. And it was nice to have everybody back in the center again. I thought everything went pretty good.
It was a nice weekend.
That was it.
Thank you.
Yep, nope. Sorry I missed the Swedish Day celebration. Heard it went well. I haven't heard any complaints.
What was in your yard?
A flock of flamingos.
Oh, that's what they were.
I got flock.
Okay.
We'll leave that and move on. Dale?
No,
Chamber did a great job again this year, and thanks for, Kim and his crew for the work they did, and it was a busy time for them, and they did a good job again, so that's all I have.
Thank you. Nothing. Thank you.
Nothing. Oh, nothing.
Nothing. Nothing. Natalie?
Nothing for me.
Kim?
Nothing, sir.
Mary?
Nothing.
I have nothing.